Prasidhima, is everything okay from your side?
Yep.
Okay, okay. Askitinga namaskar. Eka maranaw Bhargavi Kutuva, Saurashtra Association Tony Askinaki Ava mini bowlerisi, ella speaker series avatang Askinaki Chukudhanno. Hindanga special guest avi dentist Ashok Ramya. Morasaradi Prasiddhi Rupamai, project coordinator Gasata, Saurashtra Association project coordinator Gasata, Tena ella show avi run Kiranjarta, Anga board of director not join Kelrasi. அங்கே வைஸ் பிரசிடென்ட் சார் இல்லை அங்கே பிரசிடென்ட் சின்னங்க ஜாயின் केल्डन एगोर लातो प्रसिद्धि माई स्टार्ट करे और गेस्ट स्पीकर के इंट्रोड्यूस करी वेले सेशन स्टार्ट करे प्रसिद्धि माई ओवर टू यू
Aski Tengo Namaskar, Mananav Prasiddhi, me current project coordinator Kinsete Saurashtra Association. So Hinda Avin or a March speaker series Sete Dr. Ashok Babu Ramya Sangadi. So Dr. Ramya Avin und der Dentist, Ontario, Umri Sete. Dr. Ramya career Indiam start Giriya before moving to Ontario. And he specializes in temporomandibular disorders and orificial pain. He also holds a master in health profession education and has served as a faculty member in Western University. Hinda, he continues to make a meaningful impact through his expertise in TMD or official pain, sleep apnea, and general dentistry. Aski Dengo, please join me in warmly welcoming Dr. Ashok Babu Ramya.
Thanks for my intro, Keratago. Good evening, Askidanga, Jukurum. Santosham in the meeting join Gertam Sataga. First time our American platform, Watagatam the chance of video, Juku Santosha Lalo. More a background already, my Sangidi, me, avi dentist mother, Bria Uria, Canada, avi more than 25 years, settled down here. I come from a dentist family, or both dentists, my sister dentist, me dentist. So, Nanadari, me dentist see hodriya, so Mutala passion modulary hodriya. Go our bob dentist aldi me hona many branding Mutala passion hodriya all these. I able to focus on it and then finally became dentist. And Mo Mielagama Avatamudula, Mo Judano Puse Kauchi, you have everything set up in Madurai, Kauchi, Canada. I want to explore something different. The Uchi, even our Bomala Mutalaga encourage care, G, try care, many. On the Pugad Kistam like Amla, on the Pugad, we getting a chance to get exposed to a different part of the world and see how dentistry goes. It was not easy in the initial days. Juku hurdles I went through. Kestampodi, Taladu, I was able to get my license. Jukkudanum help career mailed I settle hotulu. So settle whether even I used to say like after maybe 10 years me gamu firije and I go back and continue with my dad many. But at one point, circumstances aski so continue hui. Today I'm here like more than 25 years. I have two practices. Undergraduate school muchidi with specialty career after in the year 2016 in US I did a specialty in orofacial pain. So it's a long way, it's not one day thing. There is always challenges there. It does like any profession, dentistry also has challenges there, but at the same time there is big plus on dental side, but I don't want to be, favorably talking about one profession. But as a dentist, I have to, uh, you know, speak more positive about dentistry. So that will bring positive thoughts to the future generation. So Mojal Bhargavi first pusate, timi dentistry pati kari vatega tamusiyan Mojal pusas. Ikkedi vatega namni pusiya. 45 minutes nas. Dentistry is huge. So మీ 45 minutes మీ కాయ వత్తగిరತ್ತೆ ಮತ್ತೆ మీ ಥಿಂಕ್ ಇರುತ್ತವು ಸರಿ ಅವರ ಪಿಲ್ಲನ್ ಇಕ್ಕದನ ಎಡವಿ ಡೆಂಟಿಸ್ಟ್ರಿ ಚೋದತ್ತವು ಇಂಟ್ರೆಸ್ಟ್ ದೇಕರ್ ರಾಸ್ಮಿ మీ ಥಿಂಕ್ ಎರಿಯ ಮೊರ ಸರೌಂಡಿಂಗ್ ಅವಿ ಕೆನಡಾಮು ಮೋಕ್ಲೈ ಅಂಗುನ್ కొన్ని పిల్లని జీ చెర్రాని బట్ తెని చెన్నాత సితే ಅಲ್ಲಿ చెన్నాన్ మిని మెడరిన ఫ్యూచర్ కామన మీ సే గ్రూప్ ఆఫ్ చిల్డ్రన్ అతోస్ యూనివర్సిటీ లెవెల్ జాత హర్మెంగెరియ undergraduate program is the 4 years program. So tenu kuba vene tenga thought process machai tenu dentistry choose kanamni how do I so te huchi kerrini kerarani mini managena. So at the same time US mrimala mora sounding mi kunni agini purrani international dentists avi settle for moramari settle for itanu jugudanu se US se sorry to say Canada mavi athos untadi idana aurasi they are trying their best to get their license to settle down. So it's not an easy process. International dentist we settle. So at the same time, future generation interest khali tanu elam cheras minadi. Juku sandosh lahalo. Our community kunda pokad sandosh kunda pokad. Our community mri serve karate. Ik dentist virus mrte telo on points it. So keeping this in mind, I thought, okay, let me give a brief intro about how the career goes here, what are the importance of dentistry, and to conclude, I will some tips about oral hygiene and few things. Okay, let's move on then. So dentistry, what is dentistry? Dentistry is defined as evaluation, diagnosis, prevention, and treatment of diseases and conditions affecting the oral cavity or tonum kai disease. Now, dentistry is not just teeth. It's your mouth, your face, surrounding structures. All is the responsibility of dentist to take care of for the patient. So, oral cavity, maxillofacial area, and associated structures, as Mimenemari, including their impact on the human body. So, one thing you have to understand, dentist Minariavi is not just treating the oral cavity. If your oral cavity, your mouth is healthy, your teeth is healthy, then you can prevent other diseases affecting your other parts of the body. It is research has shown that there is a link between oral disease and other health. And dentists is often the first healthcare professionals to spot a wide variety of systemic diseases. Those are medical conditions like hypertension, cancer, oral cancer, which can lead to other types of cancer. So dentistry doesn't stop with just treating teeth and oral cavity. Again, dentistry is one of the most rewarding profession to pursue, which is no doubt about like any other profession. And then mundadi very olden days more our gamo prakono my dentist surgery dad hetantala dad bandidiran. Those concepts are gone. Me chodi musati avatolu saski machayi rete. In fact, our bomla juye keledu hudriya, but in the audience side, corner the patient, the public corner care dentist dad hetan, dad heti, near dad bhoran, tala dad heti amnadi, replace karen tala maris. No, those days are gone. Dentists involved in prevention and public education. Main important thing is how you can improve your oral hygiene, how you can maintain your oral hygiene, and detection and management of oral conditions. Like any other condition, the sangyamari oral cancer say, telamari disease detect dentist responsibility, aesthetic improvement. People come with so many problems these days. Aesthetic is the most important thing in this part of the world. Isar Hatolu, dentist responsibility is there, doing major cosmetic procedures. Restoration of your teeth and surrounding structures, meaning you have a cavity in your teeth, it's dentist's responsibility to restore the tooth. At the same time, if you have a broken teeth, it's dentist's responsibility. So dentist has so many components to take care of it, not just teeth alone. And correction of teeth, meaning someone has a malaligned teeth or misaligned teeth, and they that can be corrected by dentists. Next is surgery. So dentists can do from just simple tooth extraction, which is like taking out your teeth, or it can be a major surgical procedures like facial structures remodeling, or any trauma cases to restructure everything. It's all dentist responsibility. So apart from that, if someone loses the teeth now, then they can replace the teeth sometimes with denture, sometimes with implants. So there is so much scope in dentistry there. There's so many things you can do in dentistry. It's not just like olden days how they used to think. So let's see
From
this
the one
dentist.
time the question Mahati Pusulusme,
Mhm.
the Mogakalai Sangano podum kaidi problem here first to Tonurudi Kadaimini. Telaga to me kai sangasunu. The first sang yes to me, oral like a cancer also
Hi.
related to dentistry mini.
So at the cancer jatagunako, sometimes we patients happen more gums my bleeding say bleeding unna porani. So then avi general side maybe tenu konni care khalna taguran medical checkup jana tagu. But think investigation blood work carry investigation carry series. Sometimes if they have diabetes or anything hypertension, that can also show in the gums. So think of gum swelling or bleeding away. So that's just a simple thing I'm saying. Okay. So dentistry and medical side is all interconnected. Point me. Good.
Thanks, thanks.
So now dentistry is an art. You must have seen so many marketing things these days. That kona changes anavai, kai gai kirvai. For example, if someone comes with a teeth like this, we don't know what situation is coming in. So you might have an emergency that you need to go for an occasion. And if you are a dentist and you have a chance to fix this teeth and make this person happy, comfortable, he's going to be thankful to you at the same time. You're helping someone. So you have to think this way. Dentists can do many things to make people comfortable and happy. See this how we can transform this. So is that not nice? Someone came with broken teeth, and in a short period of time, we can restore the teeth and make that person comfortable to move on. And let's go on to the next one. If you see how the teeth is. Do you like this? Do you want to be like your teeth showing like this? No, in the modern world, nobody will like it. Everyone wants to have a straight teeth, nice white. You know, Many times I get a question, how the teeth is so white. So there are many answers to that. Okay, first of all, we need to know someone is doing a whitening thing, simple basic teeth whitening, or they have done some other cosmetic procedures to show the teeth white. So how do you know that? If unless you become a dentist, you're not going to understand all these. So I don't expect everyone to be dentists. At the same time, dentistry is so interesting to do. That's what I mean to say. at the next slide, see how the teeth changed from where it was and how it looks. So keeping all this in mind, let's move on with, how the carrier goes here in USA and Canada. So to me, it's both are same. There are some differences between one country to another, as every country's their governing body has their own set of guidelines which they follow. Let's move on to the next slide. See. So if you take as a career in dentistry, how the academics goes, uh, most of the students, they go through the undergraduate program, which is 3 to 4 years program, which it doesn't matter whether it's Canada or United States, both are same. It can be a 3 to 4 years program. Some schools, they do accept in the third year. Once you complete third year's undergrad program, you can go into dentistry. Some looks for 4 years program. They have some criteria to follow, which they look for general biochemistry, human or animal physiology, humanities or social sciences, life sciences, etc. So every school look for something little bit variation, but more or less same. It's not something major differences you see. So you choose to study in United States or Canada, it's more or less the same. That's what I'm trying to say. The next thing what they look for is that, which is in Canada, they call it dental aptitude test. In US, it's like dental admission test. More or less, it's almost same. So you have to complete that. Along with that, in Canada, they ask for something called Casper test, which is, your open response situational judgment test, that which is like to find out how your social intelligence and professionalism, etc. And then they look for English test. I'm pretty sure US also has the same thing. They look for English test, but when I went through some of the schools, they were not really mandatory on it. But if you come from another part of the country, if you're an international dentist, the criteria changes. The requirements are different. Okay, but I'm talking here about the children who grow up here, who goes to undergrad school here and who wants to proceed to future in medicine, dentistry, or whatever the program. But and then also I mentioned about later how international dentists go through, which we'll talk about after. So with this, your undergraduate score with a GPA, your DAT, your Casper testing when it comes to Canada, and along with English test you apply to various schools. But if you see the opportunities in Canada and US, it's a big difference there. Canada is a small country. The population is like less compared to it's 1/10 of the US population. In the same way, the number of schools in Canada is, you see that there's only 10 schools and approximately around 600 to 650 students goes each year in out of all these schools, and they have limited availability for international students. So Canada is a more conservative country, I can say. They want Canadians to join. They look for one of the criteria is the students has to be a permanent resident or Canadian citizen. So majority of the students are selected based from Canadian origin. Only few international opportunities they give. But in US, it's not like that. I've seen students from other parts of the world joining it because there is opportunities are more. There are 60 dental schools there, and which each school has anywhere from 70 to 80. Some schools have more than 100 seats in each batch. So 100 students each year times you see number of schools there. So there are opportunities of more. If I ask a student from United States to come to Canada, they will. I don't think they prefer to, but the other way around, Canadians like to go to US and study, even though the fees is more. They think their scope is much better. To me, Canada or US is same. I've been in this part of the world like more than 25 years. Uh, I don't see anything difference. But if someone thinks it's different, they can try doing their education anywhere. So the length of the program, the duration of the program is more or less same. 4 years program. and the end of the program, they earn a DDS or DMD degree, which is Doctor of Dental Surgery or Doctor of Dental Medicine. There's no difference in this case. Okay, both has separate governing body. In Canada, there is is you can apply through direct application, or you can apply through Associated American Dental School Application Service. In US is also same thing. University application there is a common platform where you can apply through that, so that they will distribute to whichever school you choose to apply for it. Now, the big difference is after you complete the program, 4 years program, Canada has a little easier tool to get the license in compared to US. When you finish the 4-year program, Canadians expect the Canadian National Dental Examining Board expect to write one exam, which is a theoretical exam to evaluate students' capability and their knowledge, and they will issue a license depending on any province you apply for. So you can study in any school in Canada, and you can get the license in one state. And if you move on to another province, sorry, we don't call it state here. Here is province. So when you move on to the next province, all you have to do is with all your credentials, you have to register there in the local that province. But in United States, it's different. So you have two written exams used to be in the past. Now they made it as one written exam, which is called Integrated National Board Dental Exam, which is which really based on the same whatever the protocol they followed from before, basic sciences and clinical dental sciences. Once you finish that, then you have to take something called Regional Dental Exam, Clinical Exam Board. For example, CRDTS, which is the Central Regional Dental Testing Service, and WREB, which is the Western Regional Examining Board. So they have different regions, different guidelines they follow to issue a dental license to the graduated students. So, for example, if you choose to work in Western region, you have to take Western Regional Board, but you cannot go practice in other region. There is a certain timeline there. In the past, it used to be 5 years. I think there is no changes to even today, that after 5 years, if you choose to practice in different region, then you have to apply to that region with all your credentials to get the license to practice in the other region. They call it something called reciprocity, which is like, you practice from one region, you move on to the other region after a certain time frame. But end of the day, you don't have to retake the exams to move on from one region to another region. So keeping this in mind, more or less, Canada has little shorter pathway to get the license after the school, but US is a bit little challenging. Again, this is not today. It has been like this for years and years, and most of the students are being trained to perform their exams well during their academic years, and that brings them to successfully get their license to practice to move on. Now, as I mentioned, international dentist has a different pathway to follow when they move on from different countries to Canada or US. In Canada, we have two different systems. One is the direct licensing system, where they don't have to go to a dental program. They can straight away write the examining board exam, there are 3 exams there, which is 1 written and 2 clinical exams. And once they finish that, they will be given the license to practice in Canada. Also, if they wanted to go through the school program, like in US, what they have is there is a 2 years or 3 years international dentistry program for graduates from non-accredited dental program from different countries. So they go through the school program as 2 or 3 years. And if it's in Canada, they write one written exam like how the local students write, and then they get the license. In US, the same way how the local students write their regional board, the international students also write the regional board after they complete the DDS or DMD program. But apart from that, in US, there is other pathways to get the license to practice dentistry. They call it like CODA approved, which is the Commission on Dental Accreditation. There are some programs, advanced standing programs, for example, advanced education general dentistry, and various other specialty programs. If you do any specialty program, CODA approved specialty programs, there are states where they allow you to write the regional board. So back in 2016, I did my specialty in orofacial pain in University of Rochester, New York. When I finished that 2 years program, I came to know that I can also write regional board exams to get licensed to practice general dentistry in some of the regions. So that's how I took Western Regional Board. Now I have a license to practice in Texas, but I haven't gone to practice there. I may still maintain my license annual basis with, whatever the requirements. So there are some plus and minus, I can say. I should not say it this way. Um, it's more or less the program is same. There is the governing body has set up the guidelines a little bit differently to get the license to practice in Canada or United States. Now, if you take specialty program, it's more or less same in Canada or United States. It's a 2 to 3 years program generally of any specialty except oral and maxillofacial surgeon, like oral surgeons. That program can go anywhere from 4 to 6 years, whether it's United States or Canada. Now, if you ask me how competitive in this, it is very competitive. There are the number of positions they have, the number of you know uh, spots they have every year is not too much. So too many, sorry. It's if you take some program, they have only 2 candidates they take each year. Some program they have only 5 or 6. Some schools they take like 10 to 12 candidates. Out of 10 to 12 candidates, they might take 8 to 10 like local candidates and few international candidates. So it is very challenging, but it's not like impossible. See, end of the day, we follow the requirements and we work hard to get those completed. I don't think anything is difficult in this case. We can achieve whatever we want to. I always take me as an example to my children. You know, I did my dentistry for 20 years. And when I got an opportunity after practicing for 20 years, I did not hesitate to go back to school. I went back to school again, like back then how I did dentistry. 2 years, I used to go from Canada to US every week. And sometimes I had to come back and practice during the weekend. So it wasn't easy at all. And on top of it, I did my master's in uh, health profession education. So I did my specialty, I did my, you know, master's in health profession. I'm not trying to say that I did so many things. No, I'm trying to encourage the future education that they should also work hard and see how they can get into their interest of profession. But again, because we're talking about dentistry, I encourage many of them to join dentistry and become future dentists to help this part of the world and the community. That's very important. Now, there is one more important thing I want to mention here is um, in Canada, some of the international programs are recognized. For example, um, if you study in US and you want to come to Canada, you don't have to go through again school program like how international dentists from other part of the world. If you see here, countries like Australia, Ireland, New Zealand, US, you can, if you educated from their undergraduate dentistry program, you can apply your license here, where they will ask you to write the same written exam what a local student writes, and then they can get their license to practice here. In US, same thing. Some of the countries they accept, like for example, if Canadians study and they want to go to US to practice, then they have to do something called regional board exams and choose their region to practice there. But if someone from international dentist, as I mentioned earlier, then they have to go through 2 or 3 years, again, the undergraduate dentistry program, and then they can take the licensing to practice in US or Canada. Now, last thing is fees. Many of them, when I talk to students, they say, oh, it's so expensive to join medicine or dentistry. But, which is cheaper today? Like every single education is expensive here. Your main scope is what you want to be future. So I know it's expensive, but it's not like difficult. Your parents will support, or you get loans. So if you join dentistry or medicine, the banks or there are some other organization, they come forward to support for education. When it comes to fees, Canadian schools have comparatively less fees than the United States. Okay, for local students, Canadian school fees range usually from anywhere from 25,000 to 50,000 per year. It's a 4 years program, so you can calculate how much will be. But at the same time, if an international student comes, it is always expensive. It is more expensive, which is no doubt. In US, it is somewhere around 50 to 75,000 annually. That is what this, fees for every year, which it is bit expensive, but that's the way, their school system has been set it up like that. So keeping all this in mind, dentistry doesn't stop with just being a general dentist. There is so many specialties there. So you can still move on if you want to be a specialist, you want to be a dentistry in a specialty where you want to settle down in the future as a specialist dentist. Now let's move on to the specialty here. If you see this, these slides are busy, I know, but it looks like it's so busy, and the way I plotted out, it looks different, but more or less both the countries have same number of specialties. So if you see here in Canada, we have dental anesthesia, which is the same in United States also. What is dental anesthesia? It's a study of dentistry, which is focused more on a localized what do you call um, localized procedure which they do to move on to do the procedures comfortably, which is an anesthesia procedure where we numb the localized area, or sometimes we do a generalized body numbness for the dental treatment to move on. So that's same as both countries has that specialty. Next one is dental public health, which is the diagnosis, prevention, and control of dental diseases and the promotion of oral health through organized community effects. It's a community-based service program. So people who like to work on community service, want to educate public, want to educate people, so they choose to do the dental public health, and they move on their future in that specialty. Next is endodontics. Many of them must have heard of it these days, root canal treatment. I see patients every day. They decide and come when they say there is a big cavity in the mouth, which is the decay there in the mouth, in the teeth, and they say, "Oh, I think I need a root canal treatment." That much exposure has come. That much information is there in the media and the platforms there, your digital platforms. So endodontics is like morphology, physiology, and pathology of dental pulp and periradicular tissues. What does it mean? So the tooth gets sensation through a tissue called pulp, where the nerves supply to the tooth. And if that nerve gets infected, then obviously it has to be treated differently. So that's a specialty which covers endodontics. Next is oral and maxillofacial surgery, which is surgery which starts from simple extraction, which is pulling out of teeth, to a major any surgical procedures like traumatic cases of repositioning the jaw bones, or modifying the jawbone shapes to improve the patient aesthetics. There are so many things to go on there. And same specialty is there in United States also. And there's a bit difference if you see in the next specialty, oral medicine and pathology, but in United States, they have oral and maxillofacial pathology only. So they just divided. They don't want to keep oral medicine and pathology together, so they kept pathology separately and oral medicine separately. So that's basically its diagnosis, non-surgical management of diseases of the mouth, jaws, and related structures, including oral cancer. So like I was mentioning earlier, oral cancer is the more important source for to find out whether it has spread to the other parts of the body. A dentist has a major role in diagnosing the patients when they come in on a daily basis to the practice. So today's world, many offices they have something called oral cancer screening program when all those patients they come to the practice to avoid any mistreatment to the patients they see. And the next one is orofacial pain. Let's come to that later. But let's finish off the other. Why I highlighted in red? That's my area of specialty, and there is a difference. That's the reason I highlighted that. If you take the next specialty is orthodontics and dentofacial orthopedics, which is alignment of teeth and jaws. So sometimes it's a combination facts. The orthodontists they try to correct the teeth and also they correct the shape of the jaws along with the help of oral surgeon, or they move the jaws front or back to align their teeth as well as dentofacial structures. So that's the next specialty. And then the next one is the pediatric dentistry, which is the treatment of the management and primary and adult dentition of the infants, children through adolescence. So it's basically children's dentistry. And the next one is periodontics, which is treating the gums diseases and the surrounding structures. And the last one is prosthodontics, which is the diagnosis, restoration, and maintenance of oral function with artificial teeth, like dentures, uh, which can be a partial, like some patients have missing tooth, few missing tooth. Some of them will have complete missing tooth. So the prosthodontist is the one, who takes care of those patients who has missing tooth. Today's world, more than dentures, now implants have come in place. Many of them prefers implants than replacing with removable dentures, where there are challenges to get practice to that, get comfortability to using dentures. As in place of dentures, implants has become more convenient to replace missing tooth, and the patient comfort is it's really beneficial and comfortable to patients most in comparison to the dentures there. Now, why I highlighted the specialty orofacial pain, it's not just I'm specialized in that. The specialty is only there in United States, not in Canada. So in Canada, according to the governing body, I'm a general dentist. But in United States, I'm a specialist. You know, so it's what does orofacial pain mean? It's diagnosing and treating pain disorders in the head, neck, face, and jaw, including conditions like temporomandibular disorders, which is your jaw joint. Every single one has the two joints on either side in front of your ear. That joint has a lot of functions, and dentist it's the responsibility apart from taking care of teeth and um, other structures. It's their responsibility to look after the joint and educate the patients how they can manage on a long-term basis. So having said there is 10 specialties in Canada and 12, it's more or less same. There is only one difference is the orofacial pain. And I'm proud I'm one among the specialists, to be in that field. So why I showed this specialty details is a dentist can be as a general dentist, or if they want to choose a specialty like in medicine, they can move on to be a specialist. I have seen a dental specialist being practicing as a specialty person, as well as they do general dentistry also on the side, because they want to keep their hands using for both sides, because some of them don't want to be focusing more on specialty what they done it. If you see the next slide, this is the complete dental timeline here. As a dentist, they can do all procedures what is there in this picture. If you see there is a healthy tooth where you can educate the patient and prevent further any complicated procedures, complicated diseases, by educating them to keep their hygiene maintained on a regularly basis. Now, if they don't maintain their proper hygiene, then there can be a tooth decay. The tooth decay, depending on the size and the extent of decay, we can be restored just with a simple restoration, or then if the decay become extensive, then it will infect the underlying pulp and surrounding structures, where need to be restored differently with root canal treatment, which is you see on the number 5 of the picture. Now, there are times you don't have to have a decay in the teeth, but the surrounding gum tissue get infected, and then the infection will spread on in the surrounding areas. So that's more of gum infection. Now, as I mentioned earlier, all these specialties can be done by dentists. Again, extraction, surgical procedures, that also a general dentist can do. And if they want to restore it, they can restore it with implants, or they can do with a removable denture. So the dentistry profession is set it up in such a way a general dentist can perform all the procedures, don't have to be a specialist to do a particular treatment procedure. So that's the big advantages of being in the dentistry field. Okay, in comparison to medicine, now if you become a doctor and you have to choose a residency program, either it has to be a family medicine, or it has to be pediatrics, or it has to be orthopedic. So you have to choose a specialty to settle down for your future practice to move on. But in dentistry, it's not like that. You can do dentistry and get your license to practice the dentistry as a dentist, and you can do all the procedures. So that's the positive side of being a dentist. Okay, no other profession in medical side where you can do all the treatments like a dentist, what they do in the day-to-day life. So that's a big plus. That's the reason I place this slide where students get thoughts about why they have to choose dentistry than medicine. I'm not saying they should not go into medicine, but dentistry is also equally important and interesting to choose as a future career. So, but again, it has to have every single one has to have an interest. Without the interest, somebody cannot just push someone to get into that profession. So interest is very important. Apart from being a dentist, there are other dental career opportunities there. Something called dental hygienist, where they do only dental cleaning, and where the school program is like 2 years they have to go through after they complete their undergraduate program, or after they complete their high school, they straight away can join dental hygiene program, and which is 2 years program. Some schools they go for 3 years and they become a dental hygienist. There is another program called denturist. It's only in Canada. It's not in the United States there, where they make only dentures, which is the artificial teeth for patients with partial or complete missing tooth. And there is another career called dental assistants, where they help dentists to work with in the practice. And the last one is dental lab technicians, who fabricates only dentures, crowns, orthodontic appliances, and more. So again, this additional other dental career opportunities I just mentioned because Some of them, they don't know how they have to move on. I've seen dentists who comes from other part of the world. They they think, getting license here is challenging, that they choose to go as a dental hygienist and they move on. But after a few years, they when they are comfortable, they take the dental license and they become dentists. So I'm not saying that, you should choose any of one of these. These are the uh, what do you call academic things available where you can choose to move on, which way you want to settle down. Now, uh, then dentistry, as I said before, it's not just fixing teeth. It has got a lot of responsibilities as a dentist. We create smiles, which is very important this, today's world. Can anyone like to go out on a daily basis with a decayed tooth or a broken tooth or a not aligned tooth? No. So it's dentist's responsibility to create smiles, relieves or alleviates pain. So if I've seen in my dental care practice for like more than 20 years here, if I ask a patient, what is the worst pain you've gone through in your life? They say dental pain. It is sharp shooting, shocking pain, which is not bearable at all. I've seen some ladies mention to me like their labor pain was not even that painful, but the tooth pain they can't even bear it. It is so painful. It's very difficult to describe because someone who has gone through, they know how painful is it. So before before even you, just because I've given you some info, you should not, say, okay, I also want to go to dentist. Explore yourself, think yourself, okay, whether, do you enjoy interacting with and helping patients or, people? Would you like to have a career that offers challenging and variety on a day-to-day life? And also, would you enjoy being self-employed? Dentistry has a big positive side. You can be self-employed, or you can work in a hospital setup or in a community setup. So, but there is a privilege of being you work in a self-employed environment. Also, are you interested in helping people maintain and improve their oral health? And do you have good manual dexterity and spatial judgment? So you have to, as I said, you have to explore. You have to see what is your level of skills. Where you can accommodate to says to focus on which profession you like to settle down. But again, dentistry is not a profession. Dentist, sorry, my battery is running low. Just give me 1 second. So dentist is such a good profession where, all the future education should show interest in becoming a dentist. That is what my point is. I hear every day um, students saying like, I want to be a medical doctor. I want to be a pharmacist. I want to be an engineer. But how many I come across that they want to become a dentist? Not many. I don't even know why. Is it like they're not exposed to the dental environment, or the parents not encouraging, or what is lacking? I don't even know. Even my children, I ask them, they say like, they still don't know. They want to go into medicine. If I ask them, do you want to become a dentist? They're not sure about it. But again, it's it's their choice what they want to choose. But dentist is such a good profession where you have so many advantages in helping public and patients to make their life comfortable, beautiful, and live a healthy life for them. So, keeping this in mind, um, you guys, the future students, should see whether dentistry is going to be your future career or not.
Chukku Santosh, that a lot of you have exposed kids today with a lot of special.
I'm going to me, but my computer is frozen for some reason.
Oh, sorry. Nee.
Okay.
Okay. Go
Okay.
ahead, please.
So before I finish it, I just want to give you some oral hygiene tips. Okay. You all know this. You've been going to dentist to, for your regular checkup. I hope so. Keeping that in mind, you know, please maintain your oral hygiene. Maintaining oral hygiene is not just you're maintaining your oral hygiene. You're taking care of your whole body. Mouth is an important source for the infection to spread to the other parts of the body, which will complicate and ruin your entire body and life. So, keeping that in mind, brush twice daily, following proper brushing techniques with toothbrush and paste, floss 1 to 2 times daily, and rinse after every meal. Limit sugary and acidic foods and drinks as much as possible. I see here children, they take lots of soda drinks and citrus juices, and they don't rinse their mouth after, which is not going to be beneficial to them. It's more harmful. And replace your toothbrush every 2 to 3 months and visit dentists every 6 months for a professional cleaning, which will remove your plaque tartar, thereby eliminating gum diseases and early detection of other dental um, diseases, okay, like cavities and gum diseases, okay. Now, before I conclude, I just want to say one more thing about dentistry. As I mentioned earlier, it's not just teeth and the oral cavity. There is an important joint which we uses every day, and the maximum use joint is the temporomandibular joint, which I mentioned as my area of specialty. Which and this is the only bone has two sides connection. So it's very challenging to manage if someone comes with any kind of pain or other symptoms. So, how do you avoid having any pain or something like clicking, popping sound or stiffness in opening your jaw and closing? How we can avoid on a daily basis is eat smaller bites as much as possible. I see people, taking a big bites like apple biting, burger biting, so which is not good for in the long run. Also, avoid chewing hot, chewy food frequently. Many of you take the granola bars every morning, chewing gum, chewing sticky, chewy food, and then after you followed by eating chips, pizza crust. So, how much you are using your jaw? As I said, this is the most difficult joint to manage in the human body, and this is the only joint has both sides connection. And if the maximum use joint, as I mentioned before. So keeping all this in mind, follow the instruction what I've given here if you can, which will be helpful for your day-to-day life to avoid having any symptoms in your jaw joint. So to conclude, to live a healthy life, maintain proper oral hygiene, and keep your teeth, oral cavity healthy. Thank you. Thanks for listening. I hope I was able to give you some information about dentistry and its career. Again, we can keep talking about it forever, but the timeline what was given to me was limited. So with that, I conclude my presentation. Thank you very much.
Cu ಸಂತೋಷ ಎಡ್ಕ ಕ್ವಶನ್ಸ್ ಅಸ್ಕೆ ಐರಿಸಿ ಪ್ರಸಿದ್ಧಿ ಮಾಹಿತಿ ತುಂಗು ಜೋಲವಿ ಇತ್ತಲ್ಲ ಕ್ವಶನ್ಸ್ ಗೆ ಪುಸೈ ತುಮಿ ಜುಕ್ಕು ಇನ್ಫಾರ್ಮೇಟಿವ್ ka ಹಿಂದ ಜುಕ್ಕು ಡೀಟೇಲ್ಸ್ ಸಂಗಿರಾಸಿ ಡೆಂಟಿಸ್ಟ್ರಿ ಮಿಕ್ಕಸ್ 12 ಸ್ಪೆಷಾಲಿಟೀಸ್ 10 ಸ್ಪೆಷಾಲಿಟೀಸ್ ಸೇಮನತ ಕೊಂಗನಕಲಾನ ತಲ ನೀನಾತ ಅಂಗುತ ಡೆಂಟಲ್ ಹೈಜೀನ್ ತೋನಿ ಜಾಯಿನ್ ಕೆಲ್ವಾ ಇಂಟರ್ನ್ಯಾಷನಲ್ ಸ್ಟೂಡೆಂಟ್ಸ್ ಮನತೆ ತಲಮ ತೋನಿ ಮನ ಜಾಯಿನ್ ಕೆಲ್ವಾ ಐ ಇಟ್ಸ್ ಆಲ್ ಅ ವೆರಿ ಐ ಓಪನಿಂಗ್ ಥಿಂಗ್ ಅಂಡ್ main kan tumi aski area cover keras fees toni like how much the fees cost so that's the main thing as well to be avi course to professionals and there is also a long term longevity in this profession too you are the proof for that so anga pillanu kelaski sange jukudannu prasidhi mayata question proceed kare
Okay, go on, please.
Hi, yes, we can start with the questions. So me more screen share karus and I'll present the questions we received. Um, okay. So the first question, so we have Aishwarya from Madurai who's trying to apply for the PASS program. Do you have any tips or advice for her?
So she's an international dentist from India. Then,
Yes.
so let me, as I mentioned earlier, you can apply to school program, either DDS or DMD program, or if you think like, okay, I've already done general dentistry, I don't want to do the same thing. She can go through CODA approved, which is the Commission on Dental Accreditation, any specialty program. And there are some regions, they do allow to take regional licensing board. Like I say, me as a good example, I did orofacial pain program in Rochester, New York, and then I took Western Regional Board. I have license to practice in Texas. So if you're not very particular about where you you want to practice, like you're open to any region, then you don't have to really undergo the 2 or 3 years international dentistry program. You can choose a specialty program and get licensed to practice. But if you're very particular about where you want to settle down, then you have to get in touch with the regional board and see what is their requirements, and based on that, you should choose the program to apply. Again, PASS is a common platform where you can apply undergraduate program as well as specialty program. I hope I answer your question.
Okay.
Yes, sir. Thank you so much, sir.
No, you're welcome.
Yeah.
Good luck.
Okay. Thank you.
Okay. And then for the next question, any comments on how competitive this business is, and do you recommend younger generation in US or Canada to work or start business?
As I mentioned during my presentation, it's an individual preference whether they want to practice in US or Canada. Both places have their scope in the industry. If you ask me, there is no challenges, there is no competition there. It is everywhere. Where is no? At the same time, recently I read a news in Oral Health Weekly here, and in Manhattan, New York, they have a shortage of dentists. So many dentists are retiring. So the same way in Canada, there are many dentists settling down in southern region of Canada, not moving on to eastern and northern region because of the weather facts and the population. So it is an individual preference where they want to move on, but wherever you go, there is scope and competition also there. That doesn't mean that you cannot overcome this. It is possible. So either Canada or US, it's still the same to me. I hope I answered, Vijay.
Yes, indeed. Thanks, Ashok. So I mean, recommendation for a younger generation to be start off with working for a few years and then switch to business. I mean, that was also a part of the question.
So
assume US में थोड़ा का
yeah.
US में भी.
So you come again with that question. Me full again. Coming for the younger generation.
So Choditya, college Audia. Would you recommend them working 2-3 years before getting into business? I mean, is that a natural route or
Yeah.
you know?
Generally, you're asking about setting up their own practice to do or working in a
right. And is it still lucrative, like working for somebody, like 8 hours, whatever it is on a daily basis,
so
and they don't have to even go to a business? It's still a good payoff.
Yeah, it is. So it's a good question. Many of times, the concern about every student who goes to dental or medical school is the expenses, how much they are. So when they come out of the school, they have so much debt. Their next worries is like, oh, I have to pay off so much before I move on to the other things in my life. Keeping that in mind, many of them will start with working under somebody for X number of years. until they have a comfort zone. Then they decided to, start their own practice, or they might continue to work on like that because there is less responsibility in managing a practice than, you working with somebody else. So it has plus and minuses, but most of them, even me, when I got my license, I did work under somebody for almost like 5, 6 years. And then simultaneously, I started opening my practice and I still continue to work with them. And then at one point, I said, okay, let me just work for me. Good enough?
Got it. Yeah, thanks, Ashok. Yeah, clear answer.
Okay. So next question is, what is the most fulfilling aspect of your career?
Everything. Everything. Whatever I've achieved is a fulfilling part. Whatever I do every day is fulfilling. Without this, I can't move on to the next day. There is always, negatives there. There is always challenges there. Which profession doesn't have a challenge? As I mentioned, after 20 years in general dentistry, I moved on to do a specialty back to school with a different mindset, and I overcome that, and again back to my practicing. So it's every new thing is a learning curve, and if you learn that, it's fulfilling for you. Is
Okay,
that good enough?
good answer. Next question is, there seems to be a trend of medical professionals transitioning into other careers. How does dentistry compare in terms of stress levels?
Highly stressful. Sorry to say this. Which profession doesn't have a stress? Every single profession has a stress there. But how you handle the situation, that is the most important thing. Okay. Why is only medicine and dentistry? Is it not a engineering profession has a stress there? Is it not a law profession as a dentist? I mean, a stress there. So everywhere is there. How you handle it, it's most important thing. By the by, in Canada, I've seen some dentists are also lawyers. My family physician, current physician now, who's a senior man, who was oral surgeon as a dentist and became as a family physician. And he was practicing both for a long time. So there's no stress. It's a double stress. So how you handle and how you overcome is very important. Okay.
Okay.
Good.
Next question is, thank you for your amazing presentation. I have a question regarding regional licensing exams in the US that you mentioned. Do you have to take it for each state you decide to work, like the nursing licensing exams, or is it as North, East, West, South regions?
They have 4 regions. So you Northeast region, Western region, Central region, and one more. So you can, depending on where you want to live, where you want to practice, you choose that regional board exams and you pass and get the license. And if you decide to move on to a different region, as I was mentioning in the presentation, there is something called reciprocally, you can get the approval from the other regional board, which they will give you after, I think, approximately after 5 years, and where you don't have to take exam again. With the experience of one region, they will accommodate you in the other region to practice. Good enough?
Okay. The next question is, how should I approach a healthcare professional for internship, shadowing, or volunteering opportunities?
Okay. This is a question is difficult to answer because the how much availability is there, how competitive is there is very important. You might be thinking you want to do a shadowing in a hospital environment, but the challenge is when it's highly competitive, I know. So you have to see where there should be some regional platform where they have information how you can apply for your shadowing program or volunteering program in a hospital or a private practice setup. Or if you want to see in a private practice, you can always walk in through the door and reach out to them, or you can call them and ask, is there anything availability there? Internship program is mostly through the schools. There is nothing called privately you can do internship. So if you go into the school website, you can get information on the internship program. There is advanced education there after you finish your undergraduate school program, where you can apply for the internship through these schools. But shadowing or volunteering opportunities is mainly up to the individual person who owns that environment and who is there any availability there. They are the one who has to decide. You have there should be community-based platform there where you can apply for volunteering opportunities, which you can apply through, or you can go through individual ones to reach out and see whether there is anything opening there.
Next question we have is, I have noticed that dental procedures are quite expensive in the US. What are the reasons behind this? Due to the high cost, many people hesitate to prioritize dental treatment and often postpone it as long as possible.
Good question. So, not like other part of the world, for example, Indian, there is no proper fee guidelines dentist has to follow. But in the United States and Canada, there is something called fee structure, which has been developed by the local governing body and the association. For example, in Ontario, Canada, I get this question often in my practice too. Why is it so expensive? It is not, I'm deciding. There are set of people who evaluate, who analyzes the cost factor for everything to run the practice, dentist fees, hygienist fees, dental administrative fees, plus extra, etc. So based on that, they develop a fee guide, and every dentist in the region has to follow. What they say is you can charge your own fees, but 99% of the time, most of the dentists follow that fee guidelines. They don't want to charge anything more. I've seen charging less, but not more. But if you ask me why the high cost, as I said, it is not one thing I can answer. It's multiple factors. So at least we have a guide, we have a set of fee guides which we following. Unlike if you go to India, every dentist has his own fees. One can charge you 100 rupees, another one can charge you 1,000 rupees. It's their own interest on that. So you should not really think it's expensive. If it's really necessary and it's a mandatory for you, you should do it without postponing. If you postpone, then that is going to make more complication and make you spend more money on it. And it's going to affect your health. I hope I answered your question.
Okay. Next question is, when is the best time to start gaining experience in the healthcare field?
Anytime. There is nothing called, you have to start only. I have seen high school students going and shadowing medical dental facilities, okay, or any healthcare field, just to get their awareness. So there is no set timeline. Whenever you get the opportunity, you should go on. Sometimes you may not understand anything, but as you move on, you're going to, get in more information about it. Or you can always ask when you're shadowing, somebody is going to give no limited information, which is going to be beneficial for you. So you can always make use of the opportunity what you're coming across. Good.
Okay. And then the next question, will you recommend residency program in periodontics at UF? Will I be eligible to practice dentistry in Florida or take up a regional license? Secondly, how long does it take to pay back the loan?
So I don't know the full detailed information about the regional practice um, rules and regulation in Florida, but if you reach out to that region and ask about their requirements, then you will get all the information. Again, you asked me a question, how sooner I can, pay back the loan. The average salary scale for a dentist as a beginner, it can be anywhere from 80 to 100, 120,000 per year. Now, if experience, as you get on experience, your salary range goes up, you can make, depending on number of your hours of work. For example, if you're working for somebody, it's different because the salary might be less, but if you have your own practice and you decide to work as many number of hours in a week, then you can make a lot of money there. So it's all depends on, you know, how much you make, how many hours you work, and how much you make on a salary range. But average salary range for a general dentist is, 120 to 150K, and for a specialist, anywhere from 200 to 300K. Sometimes you can go even more depending on your experience. So that gives you an idea how long will it take, to repay your loans.
Okay, da. Thank you so much, da.
Thank you.
Okay.
Okay, so we are approaching the end time. So if anybody has any last minute questions, please ask right now. We have about 1 minute left.
Kunti question put so much summer that's an amazing session. Elavi at the join getting hato kubbo saras ki tingas kina ki useful kan rai. Juku sandosh that mela mari present karea. And the
Okay.
join kera askina ki juku thanks ta. Join kera askina ki juku thanks. Elamari Saurashtra Association Tony ami ekapata programs kera rasi. ತಾತ ತಾವು ಇವತ್ತಗಾರ ಮಾರಿ ಹಂಗು ಏಕಪಟ್ಟ ಪೇರ್ ಜುಕ್ಕು ಟ್ಯಾಲೆಂಟೆಡ್ ಪ್ರೊಫೆಷನಲ್ಸ್ ತನು ಮಡ ಮಡ ಇವತ್ತಗಾರ ರಾಸಿ ಒಂಟ ಮಡಂలో ಒಂಟ ಪ್ರೊಫೆಷನಲ್ ಇವತ್ತಗಾರ రాసి तुम्ही आस्किनो अभी हंगेमो जॉइन केलनो यूथ कवी जुक्ku हेल्पफुल कन जुक्ku प्रोग्राम्स मिलो से अदा संग मरी इंटर्नशिप वॉलंटियरशिप आम्ही अभी पिల్లनक मेडिकल इंटर्नशिप धाडे रासी हंग सौराष्ट्र एसोसिएशन तो निमलो वी आर नॉन प्रॉफिट ऑर्गनाइजेशन again ಎಲ್ಲಡಂಗ ವೈಸ್ ಪ್ರೆಸಿಡೆಂಟ್ ಸರ್ ಮುಸಡತ ಸೊಮ್ಮು ತೆನು ಉಂಟವತ್ತ ಖಿಲ್ಡನ್ ಪ್ರೀತಾಜಿ
ಸಂತೋಷ್ ಎಲ್ಲ ಪಾರ್ಟಿಸಿಪೇಟ್ करता हूँ हल्दी एटलीस्ट இந்த ಎಲ್ಲ ಪ್ರೆಸೆಂಟೇಷನ್ ಆಗಿ ಹಲ್ದಿ இந்த चार पिलन इंटरेस्ट अभी डेंटिस्ट्री चेरी डेंटिस्ट पई then the future community help करता मुझे सुनादी और community அவங்க அஸ்கிதங்க चुकट हल now बन जा रही है. So I encourage all the students to show interest in the profession where they want to settle down. I would highly say dentistry is good. Again, to be being in my profession. So Chopra Choda, choose your right field and settle down. And good luck to you all.
Sure. Thanks, thanks. तुम्ही डेंटिस्ट्री मध्ये इतकं प्रोफेशन्स I mean इतकं एकच आहे म्हणजे सांगायचं जुका आश्चर्य I believe that exposure is one of the main reason like students not going into dentistry. Your lecture today, like session today, actually opened up a lot of people's mind, I believe.
Thank you very much. I'm very happy to hear that.
Thank you. Preetaji, do you want to say something?
Yeah, hi, Bhargaviji. Ramesh da இந்த ಚೊಕೊಡ್ ಹೊದಸಿ ತುರ ಯಾಗಿಯ session ತುರ presentation ಪುರ ವಿನು ಚೊಕೊಡ್ various diversity ಗನ್ ತುಮಿ explain केरी होदास Canada कोणा हरिया US कोणा साथ and dentist माइनो कोणा कोलो field कोलो तुमि जावाई and तुर experience में चೊಕೊಡ್ लायसी जुक्ku धनो so लमाम la session hinda join करना record सारे तंगमली अविनो एलाइन होता है जो हेल्पफुल कन राई और पिल्लनुगो आस्की तंगस मिली And question answers में चौकड़ होता है तला sessions में various question India में टीमली अभी join करी होता है ऐसी so it is चौकड़ लाइस theory में दे तनो पिल्ला इनो interest का ना विनो पुसी ये के कर दिया तुरा family background वो संगत हो मुझसे इधर तुरा profile तेला वो
మీ మొదల సంఖ్య మరి ஒரு போர்ட் என்ட்ரஸ் మీ రమాంగ్ హోమో మీ బాణావ్ డాక్టర్ సత్యమూర్తి జీవితంగా కలైరావాయి మధురం సత్యంగా స్కిన్ కలాయి మోస్ట్లీ ಅವನು ತನು ಫಸ್ಟ್ ಡೆಂಟಿಸ್ಟ್ ಎಲ್ಲ ಅದಗೂ
Badambuki terum hal
ಹಾಯ್
badambuki terum teduna
ಹಾಯ್ ಹಾಯ್
yeah I know
ಸೊ మీ చోరీ ముసత్తర్ మీ తెజ్జి ప్రాక్టీస్ కెరియర్ మోర్ సిస్టమ్ ల డెంటిస్ట్ న్యూ జెర్సీ ముసత్తర్ సునీత చినకుండా
oh okay
ಸೊ మీ కెనడా ವಿಸಿಟ್ ಹೋಗಿಲ್ಲ ಸೊ
okay
ಬಹುತ್ ರಿಟೈರ್ಡ್ ಹೋಗಿದೆ ಸೊ ನಿಜ ಅಂಟಿಲ್ ಪ್ಯಾಂಡಮಿಕ್ ಹಂಗೂ ಬಹು ಪ್ರಾಕ್ಟೀಸ್ ಕೆಲ್ಲದು ಹೋದೆ
Mhm.
ಮೋಸ್ಟ್ಲಿ ಡೆಂಟಿಸ್ಟ್ ಫ್ಯಾಮಿಲಿ
Yeah, haskidano bo ambomli dentist yeah.
ನೀನಿ ಬಹುಡನ್ನಿ ಸೊ
Okay. Uh-huh.
ಕಲಾನಿ ಮರ ಪ್ಲೇನ್ ಹೋನ್ಗೆ ಮಿ ಕಲಾನಿ ಬಟ್ ಐ ಸ್ಟಿಲ್ ಎನ್ಕರೇಜ್ ದಮ್
I wish we wish Akshay might miss at the sea so saying yeah our amba pra sangirastura bol Satyamuti ideology the kalaria pra our amba or motamba so they are all family askidano the kalras
Lamari mi
yeah
jugumni
no.
many aigiras kamlet when I married both first dentist our community mo. So I'm talking about 60 years back.
Mhm.
Luchi jugudanga kalairai.
Yeah. But it is great to me tunga passion gan to me ella artu khalriya so tele actually as in jugu pillala medical field direct jadaras but dentist tanga tala passion rehistanu tala artu tala field jaras but ella unta chokkodi industries boom horiya industries atapra chukkudanu ven dadi samara ata askidanu da jukku care kellariya periodontics jukku sadalde ella industries are boom industries definitely
Ile mine mi tuji tala first picture dekadi inga explain kare ka phone avi hindavi ಅದು ಸಿಂಗಾರ ನಿರ್ನಾತ ಭಾಗ ಜಾತೆ ವಿರಂಬಂಜಾರಿ
yeah definitely
So aesthetics is very important. So tell आंगो मो दूसरा काय रे का हमला झेली जेड़े दाद असरी अभी होना झेली जाता मुझसे unless you wear a mask and go out.
yes
So Dovchi अभी it's very interesting, important at the same time. Someone should have interest. It's not easy to work on because on the dadam bitara mi ke karariya. Your focus is very important in that. Dovchi interest tengagana una ami sangata musai interest avi chatani charasmana which is good. So the which is avi me more wife avi me dentist family me mania but avi amba busa cholka hoti more wife busa ni talam sagur then IT field si but avi me chota jana pode haldi manage karta office bulia udemi so she is managing my office ते వచ్చి మన పిల్లలకి మీ అవి మన ಅವ್ರ ಬೋಸ್ ರೆಡಿ ಮೀ ಏನಿ ಜುಕೋಸು ಪ್ರಾಕ್ಟೀಸ್ ಕೇಳ್ತೇವೆ ಅಟ್ಲೀಸ್ಟ್ ಮೊರ పిల్లలకి తెల ಚಾನ್ಸ್ అయితే తెను యూటిలైజ్ కెళ్ళంగే ఏమైతే మీ డైలీ దంగే ఎడ్యుకేట్ కదా బట్ ఐ కెనాట్ పుష్ దెమ్
yeah definitely tanga tala passion gan rehistanu tala field mavatam sai but it is very good to session chokkod hodasta amazing
సూపర్ థ్యాంక్స్ థ్యాంక్స్
yeah vijayenda tumi vijayenda vina our association board of director gan sata
గుడ్ విజయన్ బొక్క ఆనగా నేను చొక్కర్ కళ అయితే వచ్చి
yeah I know
Yeah, sure.
I know
Yeah. We are friends for 25 years only. Right, Ashok?
oh okay
Yeah, thanks.
Vijay,
Good
a
work,
few
Ashok.
words the
థ్యాంక్ యూ
Thank you, Ashok, for sharing. Dentistry. I never thought we didn't have any students there, but it was really eye-opening. And thank you for sharing. Really.
థ్యాంక్ యూ
Chocolate, yeah. Chocolate santosh ba.
థ్యాంక్ యూ
Thank you.
వెరీ మచ్
Ashok da tura session super kan odasi mi Chandru ate kereria
Oh, honestly, Oringe.
Auriam da
Mm.
konti Brampton nu Mississauga pokadreti tura avi visit kerwai tura jal cancel kelwai sikan talamari ed anguna abbarani mi tale vekilitete
Sete, Barani Minitani, Sete si, you have to look for it, that's all.
hai Charlotte means aura mam ate keri sangatam suna teles konti viti
Pele mo kalani, pele sabi momla question me at Mudula Vate Pusle Ratalo, Boston or that my runa, so that Tamini Minasi. So the Lamari I got the Sondos Lovers, Kundina at the Canada Mula Morhola, Angun Kuni license pretty settle Hirani. So Ikosum Ikadana Avarasi, but dental field we they can't even Moga Kamni Kalari.
hai me at family physician mali find out kerasi but dentistry in the kani yeah so ella listen keriti anguna aveti chokorrai
Good.
choko odastra
Thank
thanks
you. Okay.
There's a question him na mi musaldenga juku sandosh ta juku thank you.
Thank you. Thank you
Thanks.
for the thank you.
Thank you very much ta.
Thanks. Bye.
Bye.